I was first diagnosed, I had my biopsy on Christmas Eve 2014, and I got my results on the 6th of January 2015. I first noticed the lesion on my leg in the summer of 2014. It didn't look anything like a melanoma to me. I'm a GP, thought I knew a bit about skin. Wasn't that worried about it, but it kept itching, it kept bleeding. It's ulcerated once or twice. And I thought I better go and get it checked. And I put that off because I'm from Zimbabwe and we were going back to Zimbabwe for my father-in-law's 60th birthday for 3 weeks. And I thought, oh, I can't go now because I'll miss the 2-week wait. I'll just have to be re-referred, it'll be a pain. But then the whole time I was there, I was just thinking, I was dreaming actually. Every night I kept dreaming about this thing on my leg and just not specifically articulating to myself that I thought this was really bad, but just not wanting it there, wanting it off. So when we came back, I went straight away and got a 2-week wait referral. Consultant had a look at it, said, it looks fine, but you grew up in Zimbabwe and your skin age is about 15 years older than your chronological age, and we should just get it checked. And after he said that, actually, I felt really reassured. So I pitched up on the 6th of January to the nurse appointment, not really thinking about it at all, and on my own. And the nurse said to me, the histology's not back, I'll just have a look on the system. And then she looked and her face changed and she said, it's not authorized, I need to get a doctor to come and talk to you about it. And then I knew something wasn't right. And the histology was actually an unusual kind of tumour, Spitz nevus, or a stump neuroma, a Spitz tumour of unknown malignant potential. But it was written in bold across the bottom, treat as malignant melanoma. And because I'm a GP, my whole life changed like that. There was no, oh, what does that mean, or soft landing. In a second, I fully comprehended that everything was different. I went on to have wide local excision in the sentinel lymph node. And my sentinel node, I had 2 nodes affected, one of which was completely replaced by melanoma. And then I had an abdominal and pelvic dissection as well. But the final nodes were all clear. And I came out as a 3C. My first result was the 6th of January. And I had my dissection at Easter that year, which was like the first week of April. So it was quite a 4-month sort of thing. And it was a difficult thing because of where the nodes were, and they needed a vascular surgeon to do that part of the surgery. And the logic being that, you know, we're doing this as a precautionary thing. We'd rather wait a little bit and get the right guy than sever your aortic blood vessel and have this, you know, die from a silly complication. And then, you know, just sort of 6 weeks after the end of May, I was undergoing screening for an adjuvant trial, one of the Checkmate trials. And as part of that screening, in the final week before starting, a CT scan showed that it had spread to both my lungs and my chest nodes. And I'll never know whether it was already there or whether the delay in my surgery made any difference. Well, I told Jason straight away, and he didn't comprehend it. He couldn't understand what it meant, but he could see from the look on my face that it was bad. So I think quite quickly he kind of understood this is more serious than just skin cancer. And then he spoke to all of our family and acted as I just didn't really want to talk to anyone, upset any of my family, so I just let Jason talk to them and be the sort of bridge between us and passing news on and stuff. And at that stage, Olive was 4 and Jake was 7. And it was very funny actually. Jason and I prepared and we wrote notes and we got ourselves ready for telling them. And then we sat them down and said, you know that thing that Mum had on her leg and she had to have it cut off? And well, it turned out that it was something called cancer. And my 4-year-old daughter said, what's cancer? And my 7-year-old son, who's a very clever little boy, said, oh, I know what it is. I've read about it in the library. It kills people. So that was our whole notes out the window. Never mind that. All right then, Jacob, you tell us about it. But it was good because it broke the ice, and then we talked about it and said, well, yeah, it does kill some people, but it really doesn't kill other people. And I've got a good team in Oxford, and we were very upfront, and we've always been upfront with them, and we always tell them, I'm going to an appointment, I'm having treatment, this is going to happen, I'm having a scan, the scan was okay, because we never want them to feel that we're hiding something from them. And that's not the right approach for everyone. Not every family can deal with that. And I think, there have been discussions about this very thing on one of our support groups. I don't think there is a right thing, one right thing. I think it depends what's right for your family. And I was undergoing screening for the Checkmate adjuvant trial, and at the trial centre in Oxford, and I went for a CT scan on the Tuesday, expecting to go in on Friday to start to have my first dose of epi, placebo Nevo. And on the Wednesday, I got a call from the registrar, and she just said to me very bluntly on the phone, I'm really sorry, but your CT yesterday showed that you've got tumours in both your lungs and in your chest nodes, so you're no longer suitable for the study. And I was devastated. And I said to her, are you saying I'm stage 4? Because my brain just wasn't processing it. And she said, yes, you are. And I dropped the phone and sorry. I had really dreaded that because I'd read everything, and obviously the prognostics are not great for stage 4, and there was no immunotherapy available on the NHS at that time, and everything was in trials, and it was all exciting, and I was excited for treatment, and we've all seen what's come since, and I knew the potential, but I didn't know that I'd be able to access it. So when she told me that, I was terrified. Bless him, Mark Middleton was lovely. He came out of clinic, and he came up and saw us, and he was great, and he talked through everything, and talked through immunotherapy and targeted therapy with a big piece of paper. He was just drawing cell membranes and receptors, and this is how it works. And so he just did exactly what was right for me, because he knew me, and he knew as a clinician that I needed information to feel better. And he gave me lots of information, and then he said, take these away with you, go and think about it, come and see me next week, we'll talk about it more. It's not the end of the world, don't Google it, I'm not going to tell you your prognosis. And so after that day, things got better. We went on from there. So I went back and had the whole discussion. I had my BRAF status as positive. So we went through all the options, and it came down to, I could get Ipi-Nivo on a trial. I could possibly, there were a few places still recruiting. I might be eligible for that, but it was a time delay. I could get DAB and TRAM on a trial, but again, it was a 6-week delay. Or I could get dabrafenib monotherapy on the NHS. And I decided to go ahead in the interests of timeliness. One of my lung tumours was quite big, and the chest nodes were quite big, 3 centimetres, I think the biggest one. So I chose to go for the DAB monotherapy, and I got started on that. But unfortunately, I had one cycle, 28 days. And towards the end of that 28 days, I developed a skin rash, which continued even after I stopped it, which is apparently unusual with targeted therapies, but it developed into a stage 3, grade 3 severe skin rash, and I ended up being in hospital several times, and I got massive cellulitis and a thing called eosinophilic reaction, where like a big allergic reaction in my body, and I swelled up. It was horrible. I couldn't walk. I had to lean forward like this because my back was so swollen I couldn't straighten. And I had to take really high dose steroids, and they didn't in trials at that stage, in all the immunotherapy trials, they wouldn't allow you to be in the trial if you were on steroids, or to start the trial on steroids. So it took me 7 months to get off the steroids with the skin and then adrenal problems, and by the time I got off them, it was end of January, and in February Pembroke came onto the NHS as first line. So that was just automatically my choice was to go for pembro monotherapy next, having looked at research and other indicators in relation to myself as an individual. So I chose to go on that, and I've been on that. I've had 22 infusions, the last of which was, I think, 44 days ago, at which point it was stopped because I've had some side effects along the way. None of the severe ones, thankfully. I've not been troubled by grade 3, pneumonitis, colitis, hepatitis, any of those, and I've not had to have steroids again. But unfortunately, I've lost my pituitary function in regards to my adrenal glands. So I've got secondary adrenal failure and hypopituitarism. It's affected my thyroid, and it's caused some inflammation in my eyes, in the anterior part of my eyes, and also in the back of my eyes. And I've got inflammation of the nerves in the back of my eyes, affecting my vision. So it's because of the eyes that I'm on a drug holiday. Not saying we're stopping it yet, but I suspect that probably when I go back at the end of July to review it, I think that they probably won't restart it. They might just say, let's watch and see and keep on screening. And I've had a good response. All my tumours have shrunk. Everything is stable. My last 3 scans over the last 6-month period have been stable, with nothing new. So I think that I'm guessing they might say, let's leave it and watch for waiting. Personally, I do get a lot back from support from patients and just saying, how I feel, and other people saying, don't worry, and meeting up with people and chatting to other people who are in the same boat and can just really understand where you're at and where you're at in your head, which lots of people can't understand.